Good afternoon, everyone at the Milano Center. Thank you very much for coming for this presentation called Medicare Supplement or Medicare Advantage. The choice is yours. My name is Heather Hurd. I'm a Medicare outreach consultant at Blue Cross and Blue Shield of Massachusetts, where I've worked for 18 years now, and I work out in the community. Part of my function is to do sales meetings and sales programs for Blue Cross. We usually do those at hotels. The other part of my job is to provide education in the community, and that's what I'm doing here in Melrose at the Milano Center, is giving an educational program. I am not giving Blue Cross and Blue Shield product information. So this is an educational program that compares and contrasts private plans that people buy when they have Medicare. So here's our agenda. We're going to do a very high-level review of Original Medicare, not going into a lot of detail on Original Medicare here. Then we'll talk about Medicare supplements, these are types of plans people can buy when they have Medicare. We'll also talk about Medicare Advantage plans. I'll do a comparison chart between those two types of plans. I have a case study to show you, which gives like a real example of services people have when they go to the doctor, how they're covered with a supplement in Medicare, how they're covered with a Medicare Advantage plan, so you can really compare. We'll talk about prescription drug coverage, which when you're on Medicare is known as Medicare Part D. And that's a federal benefit. You do buy it from a private insurance company, but we'll talk about how Part D works. I'll give you some things to consider and some resource information. So this is a slide called Medicare and Medicare-related options that we use in all of our presentations at Blue Cross. It explains a lot. It is showing you that the starting point, if you're considering buying private Medicare plans, is to have Medicare. So Original Medicare is made of Parts A and B. This is coverage from the federal government, and you always need to pay your Medicare Part B premium to Medicare. I'll go over that on the next slide. Some people will go on to Medicare and they'll stop right there, and they won't buy any other coverage. Most people do not, and the reason for that is Medicare is not 100% coverage. It leaves people with a couple of deductibles and 20% coinsurance. Medicare also doesn't cover a lot of preventive services or prescription drug coverage. It doesn't offer prescription coverage. So to mitigate that, people look at buying other private plans. One way is to add a supplement onto Medicare, that's secondary insurance, and then a standalone Part D prescription drug plan. People who do this have 3 insurance cards in their wallet. They have that Medicare card, a supplement card, and a prescription drug card. Other people will buy a Medicare Advantage plan, that's on the right. These plans are known as Part C of Medicare, and some people refer to them as optional replacement plans to Medicare. And the reason they call them that is because when you sign up on an Advantage plan, that plan takes over and is your primary coverage while you're on that plan. Now, you never lose Medicare, but that Advantage plan is paying all your medical claims while you're on it. It adds in a lot of additional coverage. They tend to be preventive type benefits that Medicare doesn't cover, and it can include the Part D drug coverage. So now all on one card, on that Advantage card, you've got all your benefits. So let's do a very high-level review of Medicare. Original Medicare was enacted in 1965. It's made of 2 parts, Part A and Part B. Medicare Part A is paying for inpatient type coverage. So you can think of hospital room and board, skilled nursing. That's covered by Medicare Part A, and it's premium free for most people. Now, the way Part A works is it runs on a benefit period. A benefit period begins the day someone enters an inpatient facility. It ends once they've left that inpatient facility and gone home for more than 60 days. So in 2025, if someone has an inpatient hospital stay, anywhere between 1 and 60 days in length, they have to pay a deductible of $1,676 to the hospital. and then Medicare covers the rest. So that's for the first 60 days of a hospitalization, which most people's hospital stays are less than that today. If there were a catastrophic hospital stay beyond day 60, up until day 150, there is coverage for inpatient, but people are paying a daily rate. It's called a co-insurance for being there. Now, skilled nursing, this might be considered a rehab hospital. This is covered by Original Medicare Part A as well after a 3-day inpatient stay. So as long as someone's had a 3-day inpatient stay, if they go to skilled nursing, the first 20 days Medicare pays 100%, and from day 21 to 100, they are contributing what's called a co-insurance. It's a daily rate. And people have to meet the criteria for being skilled care for skilled nursing coverage. Now, Medicare Part B pays for all doctor services and all outpatient type services, and it runs on a calendar year. So Part B is going to cover those doctor visits, labs, x-rays, MRIs, physical therapy, those things that are, happening more often. Part B is not free. Everyone on Medicare pays a monthly premium to have Part B. In 2025, the standard premium is $185 per person per month. People at higher income brackets might be asked to pay more. Most people in the nation are paying $185 this year. That can come out of a Social Security check. And if you're not collecting Social Security when you go on to Medicare, then you'll be billed for that Part B premium. The way Part B works is in the beginning of the year when you go for outpatient and doctor care, you have to satisfy a deductible. It's $257 in 2025. And then for the rest of the year, Medicare is an 80% coverage. Part B is paying 80%, you're paying 20%. So it's like an 80-20 plan. So people who have Part B are going to pay that deductible and then 20% for the rest of the year, unless they buy other insurance. And the 20% is based on a Medicare contracted rate. So there's an image of what a Medicare card looks like today. It's health insurance provided by the federal government. You can see any provider nationally that's part of Medicare, no networks, no referrals. But you don't get outpatient drug coverage with Original Medicare. Now, if you are in a facility, in a hospital, and they're giving you medicines, that's covered by Medicare. Or perhaps you need medication that's administered, infusion type therapies. That may be covered by Original Medicare. But when your doctor writes a prescription for you to go run down to the local pharmacy, Original Medicare does not cover that. So if people want more coverage, one type of plan they can buy is called a Medicare supplement. Now, the supplements exist all over the country, but we have unique supplements in Massachusetts to this state, offered by a variety of insurance companies. Supplements are also referred to as a Medigap plan, so you might have heard that term. So this is secondary insurance. You add it on to Original Medicare. The job of the plan is to follow along and pay where Medicare leaves off. So Medicare pays first, the supplement pays second. There are 3 types in Massachusetts, and the premiums range from about $120 a month to about $260 a month. And remember, you have to have Medicare first, so you're going to continue to pay that Part B premium to the federal government. So the $185 to Medicare, and then a premium to an insurance company for a supplement. So you'll show 2 insurance cards wherever you go. And because Medicare is primary, you can see any Medicare provider nationally. So there are 3 standard plans in Massachusetts offered by a variety of insurance companies. The plans are called Supplement Core, Supplement 1A, and Supplement 1. Now, the Supplement Core plans are the least expensive, and they generally cover the 20% balances after the Part B covered services, which are the outpatient and doctor services. The Supplement Core plan does not cover a hospital deductible, a Part B calendar year deductible, and it doesn't pay the skilled nursing costs from day 21 to 100. The Supplement 1A plan covers every service that Medicare covers, with the exception of that Medicare Part B deductible, the $257. So it'll pay for that hospital deductible. It pays for the skilled nursing costs. Now, the Supplement 1 plans, these plans are the only plans that cover the Part B deductible. In fact, they cover every balance after Medicare 100%. It is not written on the slide, but I just want you to know that Supplement 1 plans are not available to everyone anymore because of a federal law that was passed in 2015, known as MACRA. These plans are now available only to people who were eligible for Medicare prior to January 1 of 2020 because of that federal law. So anybody younger, they weren't eligible for Medicare before 2020, they can buy the Supplement 1A or the Core. People who were eligible for Medicare before 2020 can still buy a Supplement 1. But the Supplement 1 and the 1A, they're almost the same, and the 1A may be a better value. None of them are covering prescription drugs. You have to buy a Part D plan when you have a supplement. So let's talk about Medicare Advantage plans. So Medicare Advantage plans are offered by private insurance companies, private health plans that have a contract with Medicare. And via that contract, Medicare approves these plans with their contract. And when people sign up on an Advantage plan, Medicare kind of shifts their benefits over to that private insurance company. So that plan takes over and administers your Medicare benefits while you're on the plan. If you disenroll from an Advantage plan, you go right back on to original Medicare. So you're not giving up Medicare. Most insurance carriers offer multiple plans, with some having premiums as low as $0 per person. So all the insurance companies in Massachusetts, we all have our own portfolio of Advantage plans. Where I work at Blue Cross and Blue Shield of Massachusetts, for example, we have 7. And most of the insurance companies have a number of plans like that. So when you're on an Advantage plan, you're only showing your Medicare Advantage card wherever you go for care, because Medicare is actually funding. There's federal funding from Medicare to that private plan. So now that private plan is your primary coverage. The plans are going to cover all of your original Medicare Part A and B benefits, and they're going to add in a lot of extra benefits. Those extras tend to be preventive, so you'll see things like preventive dental, routine eye exams, money towards eyewear, hearing aids, not on the slide, but just to mention some of the other extra benefits, fitness benefits, weight loss benefits, over-the-counter benefits. So there's a lot of things added into these Advantage plans. And usually Part D prescription drug coverage is included in an Advantage plan as well. So each Medicare Advantage plan will have a summary of benefits highlighting the premium, the benefits, the cost sharing, that's what a member's paying when they go for services, and an out-of-pocket maximum. So that's very important because the Advantage plans are priced very well, some even zero. There are 0 premium plans. But you need to look at the summary of benefits. Even if the plan's a 0 premium, you're going to be paying something towards your medical services, and that can accumulate up to a number. It's called an out-of-pocket maximum, and that's the most you can contribute towards your Medicare benefits. So you want to know that figure. There are 2 types of Medicare Advantage plans in our market where we are here in Massachusetts. There are HMO plans and there are PPO plans. HMO stands for Health Maintenance Organization, and PPO stands for Preferred Provider Organization. HMO plans have been around a long time now, and these are managed care plans where members designate a PCP, a primary care provider, and if they want to see other providers that are not the primary care provider, they need to get referrals. So you may have had a plan like that in the past. And you're usually staying in the network when you're on an HMO, unless you have an urgent or emergency services. you're going to pay co-payments or costs as you go for medical care. You're contributing towards the cost of your services. PPO plans, some of them require that you identify a provider of choice. That might be a doctor that you see often, and your copayment could be lowered, but you never need referrals when you're on a PPO. You can use either in-network or out-of-network benefits. That's what people tend to like about PPO plans, is a little more flexibility. No referrals, and they can use the network of providers, but they always have an out-of-network level of benefits to any Medicare provider if they want to go out-of-network, and usually you pay more towards your out-of-network coverage. Okay, here's a comparison chart side by side of supplements and Advantage plans, and then we'll do our case study. I think the case study is really where it makes a lot of sense. So, who is providing your coverage? If you're on a Medicare supplement, Medicare remains the primary coverage, and the supplement is just paying the balances after Medicare. So, for example, the 20%. When you're on a Medicare Advantage plan, that plan is providing your coverage because the plan has contracted with Medicare to take over and administer your benefits. What are the plan options for supplements? In Massachusetts, we have the Core, the 1A, and the 1 for people who were eligible for Medicare before January 1 of 2020. And the premiums range from about $120 or more a month. That would be for the Core plan. It says $210, but I think it's more, it says up to $250. I think it's more like $260 now for the Supplement 1. The $210 would be about $220 for the Supplement 1A. What are the monthly premiums for Advantage plans? They can usually range from about $0 to $100. So the premiums are very well priced on Advantage plans. That funding's coming to the health plan from Medicare, and the member is paying costs towards their services, so the premiums can really be priced quite competitively. Network limitations. If you have Medicare and a supplement, there are no network limitations. You can see any Medicare provider. If you have an Advantage plan, if you have an HMO, you're usually using the network providers. If you have a PPO plan, you have the network providers, but you also can use out-of-network benefits. No referrals on supplements, only on HMOs, not on PPOs. Medicare covered services, what's the cost sharing? It's $0 to a very fixed amount for supplements. The out-of-pocket costs are very fixed and predictable. On an Advantage plan, you're going to pay co-payments or co-insurance as you go for services, and that, like how it ends up at the end of the year, depends on how many services you have. Extra benefits, routine dental, eyewear, hearing, usually not included in supplements. Some plans will allow you to add on a rider, for example, for routine hearing and vision. With the Advantage plans, those extra benefits, that's really what what a lot of people look for in these Advantage plans, or a lot of these extras. Prescription drug coverage is not included in a supplement. It is usually in the Advantage plans. Okay, here's a case study. And we tried to do it as best we could. We couldn't put all of the variables on there. So what's not on there is the Medicare Part B premium. So that $185 a month that everyone pays to the federal government, it's not on the slide, but just that's a given. You have to pay that for Medicare Part B. And this is a case study with Mrs. Smith, and she has a Supplement 1A with Medicare. So she's paying Part B to Medicare. She's bought a Supplement 1A plan from an insurance company. Some key points are that she can see any Medicare provider. She has no referral requirements because she's on a supplement. She has no co-pays. Supplements don't have co-pays. But she doesn't get drug coverage, Part D. So we'll come back to that, but she is going to have to buy her own Medicare Part D plan for her prescriptions. So there's another premium she has to consider. But she has predictable medical costs. So this Supplement 1A, remember, it pays every balance after Medicare except for that Part B deductible of $257. So her premium is about $210 a month. At the end of the year, she's paid $2,520 for insurance for her supplemental plan. When she goes for medical services, she sees her primary care doctor. This is just an example. She sees her primary care doctor 5 times. She has 5 specialist visits. All she's responsible for is that Part B deductible of $257. She has 3 lab tests, nothing, 2 MRIs, no copays, 6 physical therapy visits, 1 outpatient surgery. That could be an inpatient surgery. The 1A covers that $1,600 inpatient deductible. So at the end of the year, she's paid her premium, she's paid a Medicare Part B deductible, so her health costs are $2,777. She still paid Part B to Medicare, and now she has to buy a Part D drug plan. This is just a case study. Let's take a look at the same services, and this time Mrs. Smith has a Medicare PPO. She's got a PPO plan that's $75 a month. She still has to pay Part B to Medicare, the $185, but now her drug coverage is included in this plan. So that's one premium she's not going to have to consider is Medicare Part D. She's got drug coverage in this plan. So some key points are she has a PPO, she has co-payments for services, Part D is included, and there is an out-of-pocket maximum for protection. And typical out-of-pocket maximums in Massachusetts for Advantage plans are usually between about $3,000 and $10,000 a year. So you definitely want to know that number. So she pays $75 a month. At the end of the year, her insurance premiums are $900. And when she goes to see her primary care doctor, she has $10 copays. So she has 5 visits, so that costs her $50. Her specialist visits have a $40 copayment. 5 visits cost her $200. 3 labs, she has a $10 copay for her labs. You can see we're adding that up. The MRIs have a copayment of $325. That's a realistic number that you see in the market for the plans. Physical therapy visits, $20 copays. She has 6, so that totals $120. The outpatient surgery has a copay of $300. If she had the inpatient surgery, usually with Advantage plans, you pay a copayment for the first 5 or 7 days towards an inpatient stay. So at the end of the year, she has paid $2,250 for her services. She pays $75 premium. These out-of-pocket costs, she gets Part D included. So here she has a supplement. Same services. Here she has an Advantage plan. So your observation might be, well, she made out better on the Advantage plan, right? And that's true for many people, but it depends. What I'm trying to show you here is there's no right or wrong. It's which plan is best for you. I just want everybody to understand how it works. So if she had, let's say, she had 10 visits to her PCP and 10 specialist visits and 4 MRIs and physical therapy. I had PT on my hip last year. I went for like 25 visits, not 6, right? So on an Advantage plan, what the member contributes keeps going. It'll keep going until someone reaches that out-of-pocket maximum. Many people do, many people don't. So there's a little less predictability, but there's a lot of benefits for a really affordable premium, a lot of extras that people look for. You have to be comfortable with the fact that this can be moving, whereas on this side of the house, she pays a higher premium for a supplement, right? And she still needs a drug plan, but it's fixed. It doesn't matter how many services she has, it's not going to change. Okay, so let's talk about drug coverage, because it's very specific when people are on Medicare. The federal Medicare benefit for prescription coverage is known as Medicare Part D. And you can get that Part D coverage two ways. One way is to buy a standalone prescription drug plan, and that's what people who have supplements do. They buy a supplement and then they buy their own Part D drug plan, and there are many of those in the market. The other way to get Part D is have it built in or included in your Medicare Advantage plan. So if you buy an HMO or PPO, it usually comes included in the plan. Make sure it does. There are a few plans that offer Medicare Advantage with no Part D. But you want Part D if you need drug coverage. So there's a standard outline of coverage all plans have to follow because it's required by Medicare. So there may be differences in premiums if you're buying your own standalone drug plan, but the outline of coverage, Medicare sets that up, and the plans all have to follow it. So there will be an initial coverage phase. When people first join a Part D drug plan, they start out with drug coverage in the year, and they're just paying costs towards their prescriptions. There could be a deductible. This is usually on the higher tiers or the more expensive medicines. There may be a deductible that applies towards the medication. And then there's always a catastrophic level of coverage for people who pay, in 2025, $2,000 or more towards their prescriptions. Once you personally contribute $2,000 towards your medicines, you've entered what's called catastrophic coverage, and you'll pay no cost towards your medicines for the rest of the year. So if you're a Medicare supplement enrollee, if you bought a supplement, you're going to purchase a standalone prescription drug plan, Medicare Part D plan from a private insurance company. And the premiums can range. The lowest cost plan in the market in 2025 in Massachusetts, I believe, is $12 a month. And then there are plans over $100. I would say the average is about $35 a month. So there's a wide range of premiums. The national monthly average, that was 2024, $55. I think it's gone down a little bit for 2025. Join when first eligible to avoid a potential late enrollment penalty. So that's important for people who are new to Medicare. The federal government wants everybody to have Part D coverage when you are first eligible. If you have other what's called credible drug coverage, so you keep working beyond age 65 and you have your employer insurance with drug coverage, you might not have a penalty. But if you just go on to Medicare and you don't buy a drug plan, maybe because you don't take medicines, the federal government will be calculating a penalty for every month you delay. So take note of that. Medicare Advantage members, you cannot purchase standalone drug plans. If you buy a Medicare Advantage HMO or PPO and it comes with Part D coverage, you can't go out and buy another Part D plan. You have to use that Part D benefit that's built into that Advantage plan. But if you get Part D in your Advantage plan, then the benefits are embedded right in there and you don't have to pay another premium. So always check the formulary to see how your medications are covered. That's important. Every insurance company has their list of covered drugs. It's called a formulary, and Medicare approves it, and we have to cover 2 medications in every therapeutic class. But that doesn't mean we cover everything. So if you have medicines, you want to find the Medicare Part D plan that covers what you need and what you take. Fortunately, there are ways to do that. You can look on the insurance company's formulary. You can get them to mail you a formulary booklet. We all have little booklets of our formulary. And there's a way to use a comparison tool on Medicare's website called Plan Finder. And also, a wonderful service in Massachusetts is called the SHINE program. And I know you have a SHINE counselor here at the Milano Center. Shine counselors are very dedicated volunteers, and they go through special training to learn how to look up people's medications on drug formularies for various insurance companies. So if you're finding the process overwhelming to choose the right drug plan, because there's a lot of them, you could meet with Shine. So things to consider as you look at all the options. Of course, it's individual. I've done this job for a long time, and I meet couples. I meet husbands and wives that have two totally different insurance plans, because once you're on Medicare, everything's individual, and you get to choose what meets your needs, and you might have different needs than your spouse. So you want to look at your budget. How much do you want to pay? Do you want to plan with a lower premium and you're willing to pay some costs as you go for services? Do you want to pay a higher premium and just know you have predictable out-of-pocket costs? Medical usage, how often are you at the doctor? Are you one of those people that has a physical once a year and maybe one other visit? Or are you there every other month for something that you're following? So how often do you see medical providers? Flexibility. Do you want to be in a network? Are you okay with referrals, or do you want to do your own thing and go where you want? And what's your desire for extra benefits? A lot of people who look at the Advantage plans that are in the market, they're really motivated by a lot of those extra benefits, which can be, if that's important to you, very valuable. Fitness and weight loss and over-the-counter and glasses and hearing aids. And there's a lot of extras added into Advantage plans. And the prescription drug coverage, do you want your own standalone plan? Are you okay having it built into your Advantage plan? Depends, on the types of medications you're taking and which plans cover what you take. So here's a final review. Supplement plans are typically more expensive monthly premium than Medicare Advantage plans, but they have lower cost sharing towards services. But you don't get Part D drug coverage. You have to buy your own standalone Part D plan. You can see any Medicare provider, no referrals, no copays, very predictable costs. Advantage plans are typically less expensive in monthly premium than Medicare supplement plans, with cost sharing towards Medicare covered services. Most plans include the Medicare Part D drug coverage, but you have to be aware of networks. You might have to use networks of providers. The care could be coordinated, especially if you're on an HMO where you need referrals. You pay co-payments as you receive care, but there is that out-of-pocket maximum for protection. Resource slide. You have it on your slides, a way to contact Medicare. Social Security is how people first sign up for Medicare if you haven't done so yet. And there's the Shine program. That's a state toll-free number, but I know you have a Shine counselor here at the Milano Center. And just for your reference, Mass College of Pharmacy, if people have specific questions about medications, that's a free advocacy service. You can call and speak to a pharmacist or case manager. We have a pharmacy assistance program in Massachusetts called Prescription Advantage. People can sign up for that to help offset their out-of-pocket costs towards medications. There's no asset test for Prescription Advantage. And I work at Blue Cross and Blue Shield in Massachusetts. Again, my name's Heather Hurd. We have our team, the Medicare Outreach team. We have sales seminars and sales webinars presenting all of our plans. We have supplements and Advantage plans. We have dental insurance for people age 65 and older. And you can find them on our website, or that toll-free number is where you could speak to a representative in our call center if you wanted information about our plans. And that's it. Thank you very much for your attention, and I appreciate you coming today.